Hello everyone. Welcome to Atu-Net Online Global Classroom or OGC on Innovation and Technology hosted by Universiti Malaysia Perlis, UniMAP, and co-hosted by Universitas Airlangga Indonesia, Universiti Teknologi Brunei, and Shibaura Institute of Technology SIT Japan. To the respective student and everyone joining Atu-Net OGC today, before we start this program, I'd like to introduce about this program. So the Asia Technological University Network, Atu-Net offers a fresher and exciting mode of online mobility via its Atu-Net Online Global Classroom. The Atu-Net OGC covers various themes including culture and communication, pandemic and engineering, entrepreneurship, sustainable development goals. Now we have a big topic about innovation and technology on pandemic era. So this program facilitates everyone for learning, sharing and networking as well as connecting learners across the Asia and beyond. And also I'd like to introduce myself. My name is Sika as a moderator for today's program. For your information, on today's OGC, we receive 18 students in total coming from 3 different universities. 6 students from University of Malaysia Perlis, UniMAP, 6 students from Universitas Airlangga Indonesia, and 6 students, the rest from University of Technology Brunei, UTB. And then they are assigned into 3 different groups, Group 1, Group 2, and Group 3. Each group consists of students from each university. So totally there are 6 students in one group. And each group will be presenting a topic related to innovation and technology on pandemic era. Please note that this program is not designed for students to compete or to make a competition, but to learn something new, to share information, and to collaborate together. And to the audience, I'd like to remind you that this session will be recorded and your microphone will be muted by default. And if you have any question at the end of student group presentation, you may write down your question on the chat box. And don't forget to mention a specific group that you intend to ask. And to everyone joining here, please rename your ID in the Microsoft Teams platform with the abbreviation of your respective university name in front of your ID. For example, UniMAP _ Muhammad Harry, Bagus, and moreover, the attendance link and feedback link will be provided to you at the end of this program. And we will send a certificate of appreciation to the audience who have participated on this program from the beginning until the end of this program. So we hope you guys can fill out all of the required form and complete it later. And the next for the program agenda. The program agenda for today is as follows. For the organizing team, could you please show us the program agenda? Okay. So after the opening session, we will have a 3 group presentation. Each group has 25 minutes for presentation. And if you exceed that time, your group will be notified by me or by my team. So you can start to make a conclusion of your presentation as soon as possible. And after that, we will take a break for 5 minutes and then will be continued by Q&A session by the reviewers and by the audience. And each of Q&A session should be finished in 10 minutes. And after Q&A session, we are going to see of our comments by the head of the reviewer and also by each group, Group 1, Group 2, and Group 3, each for 5 minutes only. And at the end of this program, we will have a closing remarks and certificate appreciation awarding by our director, and this program will be lasted by group photo session. and surely your cooperation will be appreciated. So before I invite the first group of students to present on a selected specific topic, let me introduce the four reviewers we have today. The first reviewer is from UniMAP, Muhammad Sufino Zuhaili, Mr. Muhammad Sufino Zuhaili bin Muhammad Sufyan. He is currently a lecturer from Faculty of Applied and Human Science, University of Malaysia Perlis. Assalamualaikum, Mr. Sufino. Are you already in this room?
Yes, Waalaikumsalam.
How are you today?
I'm fine actually. Yeah,
Okay. And the second reviewer is Ms. Yusaimi. She is the Director or Chief Information Officer at ICT Center or ICTC at Universiti Teknologi Brunei. Hello, Ms. Yusaimi. Are you already online? Okay. And the third reviewer is Dr. Nico Azahari Hidayat. He is the head of Department of Engineering, Faculty of Advanced and Multidisciplinary Technology from Universitas Airlangga. Hello, Dr. Nico.
Halo, Assalamualaikum warahmatullahi
Hello.
wabarakatuh.
Okay, I'm happy to see you here.
Yes.
And the last reviewer, we have Mr. Yutaka Furia. He is the Director of Global Initiative Division of Shibaura Institute of Technology, Japan. Hello, Mr. Yutaka. Are you here? Okay, it's okay. And now it's my great pleasure to invite a student in Group 1 to deliver their presentation about potential diagnostic system to fight COVID-19 pandemic, especially about current system and the future-proof innovation. Before they start their presentation, I'd like to mention one by one student in Group 1 here. They are Fatia, Farhan, Nur Fatia, Tinghalan, Nurhanisa, and Shamimi. Hi guys, could you please turn on your camera?
Hello, Miss.
Hello, are you doing great?
Yeah, I'm doing great.
Are you ready for your presentation?
We are ready.
Okay, good. Before you start your presentation, kindly remember that you are given only 25 minutes in maximum for your duration for your presentation. So keep your time and please don't exceed the maximum duration. If you reach that time, you will be notified by us as soon as possible so that you can make a conclusion for your presentation. You got it?
Yeah.
Okay,
Sure.
good. You can start right now, please.
Okay, Bismillahirrahmanirrahim. Good morning and hello. We are from Group 1 and today our topic would be about potential diagnostic system to fight COVID-19 pandemic, current system and future-proof innovation. Here are the names of the people in our group, which are Nur Fatiha, Tinghalan, Farhan, Tia, Shamimi, and Hanisa. The presentation outline are as shown. We will talk about introduction, which is background of the topic, and current development of the system in respective countries, Malaysia, Brunei, and Indonesia. And then we will talk about examples of applications of the diagnostic system regarding the COVID-19 pandemic. And we would mention also about the achievement, success stories, impact to the current scenario of the pandemic. We would also be talking about issues and challenges, which are the problems encountered and solutions to solve the issues, future-proof innovation, and lastly, we would talk about the conclusion. So the first part, we would be talking about introduction, which is background of the topic and current development of this system.
Alright, hello everyone. My name is Nafatia binti Anwar, and I will first do on the introduction for Malaysia. Alright, today Malaysia has more than 1,364 ventilators, 120 screening public hospitals, 58 labs for coronavirus testing, and 40 hospitals that treats COVID-19, and as well as PPEs that could last up until November 2020. As of October 2020, there have been more than 150 referral hospitals and government clinics altogether across all the 14 states of Malaysia. And they have all been recognized by the Ministry of Health and handles suspected cases and authentic COVID-19 cases and also do COVID-19 screenings. However, with all these high-tech facilities, Malaysia have also been developing a lot of other systems that could help to contribute in fighting the pandemic, in which I will talk about on the examples of the applications later on. I will pass on the slide to my next presenter to introduce on the current phenomena in their country. Next.
Hello, this is Hadisa speaking. So I would be introducing about Brunei. Brunei uses RT-PCR kit swab test, which is provided by BGI Genomics and MG-ISP 960 automated sample preparation equipment, provided by MGI, as well as viral RNA extraction reagent, which helps in rapid diagnosis. Brunei also has successfully constructed an extension of the virology laboratory, Huayan Laboratory, constructed by BGI, and it had started operating on the 1st of April 2020. Initially, on average, only 50 to 60 laboratory tests were managed to be conducted per day. However, with the new virology laboratory being built, it has been designed to handle 1,000 samples daily to detect 2019 nCoV. And next, I will pass on to the next presenter to introduce about Indonesia. Before that, in this slide, as you can see, this is Dr. Zainun, which is head of the Brunei National Virology Reference Laboratory, together with our Minister of Health, Yang Berhormat Datuk Dr. Haji Muhammad Isham, visiting the Brunei Huayan Laboratory.
Assalamualaikum warahmatullahi wabarakatuh. My name is Farhan, and ladies and gentlemen, today I would like to share to you my materials for this discussions in Introductions Indonesia. First of all, I would like to tell you that I divided to 2 points: prevention and of course and protections. For prevention, in the face of the novel coronavirus 2019 pandemic situations, since the 18th of January 2020, Indonesia has conducted health checks by using body temperatures scanners for anyone entering, especially those who came from the airports. Even though we know that coronavirus has spread, but I don't blame the government of Indonesia, but the airports is still not on lockdown. Just to let you know, in accordance with international health regulation, the Indonesian government has also deployed additional personnel at airports and increased hospital preparedness. These are the three few steps that to prevent coronavirus that is being spread by the Ministry of Health. The first one is circular letters to all provincials and districts, rural hospitals, port health offices, and environmental health engineering centers to increase alertness and preparedness in facing the possibility of this disease entering. Second, there has been placing 135 thermal scanners at all airports in Indonesia, especially those with direct flights to China. And then providing health informations, communications, and educations to passengers. Next. Next, please. Yeah, for the protections, the Indonesian government has repatriated Indonesian citizens from Hubei province, China on February 2nd, 2020. These steps have been implemented for these Indonesian citizens. First, ensuring availability and access to logistics in Wuhan prior to evacuations due to the lockdown policy of the Republic of China government. The Indonesian embassy in Beijing has sent funds equal to 133 million to Indonesian citizens most of whom are students, to buy food and needs in Wuhan. Second, sending logistical assistance from Indonesia, BNPB, through the Minister of Foreign Affairs and Indonesian Embassy in Beijing have sent 10,000 and stripped 95 masks to Indonesian citizens in China. Lastly, conducted voluntary pickups for the 237 Indonesians and one foreigner who were in Hubei province on February 1st to 2nd, 2020. Next.
All right, I will talk on the examples of applications that have been in Malaysia for a while now. Okay, next. Next, please. All right. As I've told you before in the introduction part, Malaysia has a lot of high-tech facilities that could aid the COVID-19 pandemic, such as the laboratories and the testing kits. All right. Right now, Malaysia have also developed a lot of other technologies to aid in the COVID-19 pandemic. First of all is the artificial intelligence technology. In April 2020, Huawei Malaysia had offered an artificial intelligence solution to one of Malaysia's main hospitals, which is Hospital Sungai Buloh. This technology actually empowers all the local medical staff with AI capabilities. The system has been trained with more than 4,000 positive COVID-19 patients and can diagnose results up to 60 seconds. Other than that, Skymine Holdings also contributed in research and further understanding to most Malaysian researchers on the current COVID-19 pandemic by providing one of their systems, which is their Axial AI-based system, to Hospital Tuanku Fauzi Azizah, Kuala Lumpur. Next is the implementation of Movement Control Order and the Conditional Movement Control Order by the Malaysian government. This implementation of MCO and CMCO have proven to help Malaysia to curb the COVID-19 pandemic. From March 2020 up to June 2020, Malaysians have seen 0 cases of COVID-19 pandemic. However, due to some recent issues, Malaysians have actually been seen to have an increase in the number of COVID-19 cases, and the CMCO is actually prolonged until the end of 2020. This step is actually one of Malaysia's successful stories in their effort to fight the COVID-19 pandemic. All right, next.
Hi, my name is Narsmat Shamimi, and I will be talking about the examples of applications in Brunei. We have BruHealth, and the application was launched on May 28, where business premises are required to scan users' personal QR code or account history and existing premises. The main purpose of the application is for contact tracing in the event of an outbreak of infection. However, additional features have been added where users will be able to take an assessment test to check whether they should get swabbed. Or not. In the application, the users will have to answer a set of specific questions, and from the answer, each user will be assigned to a specific color code according to the symptoms they have hit into the application. For example, travel restrictions have been lifted, and Muslim men were required to book a slot for Friday prayers by choosing a mosque that they wish to go pray at. And only those being free eligible can attend Friday prayers. The application also updates users regarding the number of cases that have been discharged or infected. Next. These are the specific color code for the BruHealth. Only green and yellow code users are allowed to enter business premises or participate in activities. For red code, purple code, and blue code, the users will not be granted any permission to access the public spaces. Next. As of now, Brunei has managed to control the cases very well in the country. We have recorded zero number of domestic cases for the past 171 days. Adding on, there are only 2 more cases that are currently being treated at the isolation center. The total number of recoveries are 143 out of the total 148 confirmed cases. Next.
Right. So, for example, of applications in Indonesia, we have this application's named Peduli Lindungi. Yeah. Peduli Lindungi is an application developed to assist government agencies in tracking to stop spread of coronavirus disease, the COVID-19. This application relies on public participation to share their locations data with each other while traveling so that it will trace down the history of people who they contacted with if not they are carrying the disease. Second, users of these applications will also get notifications if they are in a crowd or in a red zone, which is an area or sub-district where there are people infected with positive COVID-19 or there are patients under surveillance. Next. Next, please.
Alright, so I'll be explaining the second part. So, how does Peduli Lindungi works actually? Peduli Lindungi uses the data produced by Bluetooth-enabled gadget to record the required information. So, when there are other gadgets within the Bluetooth radius that are also registered in Peduli Lindungi, an autonomous ID exchange will occur which will be recorded by each gadget. So, whereabouts of Bluetooth connected devices will be recorded in these gadgets to hold also as a sort of proof that you were here or you are engaged with this person. And then Peduli Lindungi will identify the people who have been in close proximity to people who have been tested with COVID-19 or PDP, which stands for or President Patients Under Monitoring, and ODP. This is especially helpful when the person cannot remember their travel history and who they have been in contact with. Peduli Lindungi really pays attention to your privacy, so even though an autonomous ID exchange will occur, but that doesn't mean that your private data will be given to others. Your data is stored or securely in an encrypted format and will not be shared with others. Your data will only be accessed if you are at risk of contracting COVID-19 and are needed to be contacted by health workers immediately. Next, please.
Okay, good morning everyone. I'm Tinggalin from Malaysia UniMAP. So, for the challenges and issues faced by Malaysians during the COVID-19 pandemic, first of all, the sharing of fake news or false information. Information related to this new pandemic transmitted very rapid online, while the virtual instantaneous dissemination of information may be helpful in some circumstances. Verifying the accuracy of the disseminated information can be potentially problematic, forcing an infodemic. The problem with spreading unverified information occurs when irresponsible residents share fake news or false information around. This has the potential to expose unsuspecting members of the public of being detective that information is true. This is morally unacceptable, especially when the spread of such information is spread intentionally to devise others. Fake news is composed to intentional misleading news that may not be entirely wrong with the aim of influence views. Secondly, disobedience of law. When the first wave hit Malaysia, the Malaysians were controlled under MCO, Movement Control Order, while then Malaysians can be follow the rules. After hitting by the second wave, the Malaysians are not longer afraid of corona, which is COVID-19. Malaysians are not following the laws and rules. We can see people wearing pink band and are moving around in the restaurants and bank. These kind of things are getting viral in social media. Even in the beginning, when government encouraged to wear the mask, most of the Malaysians didn't really care about it. When the law has been enforced, they worried to pay 1,000 ringgit as penalty and started using the face mask. Secondly, we move on to the economic part, which is debt of Malaysia. As the recent interview, our financial minister gave a statement that our debt can be raised to 60% at the end of the year. The national debt per capita increases, the likelihood of the government defaulting on its debt services obligation increases too. This will be this will make Malaysians life difficult in the future. And the second, the rate of offended on the treasury security increases. Cooperating operation in America will viewed as riser, necessarily an increasing in yield on newly issued bond. This is the Malaysian daily life been ruined in future. And finally, impact on the poor. There's a little misleading of the there's a little understanding of the impact of this harsh ability necessary on the poor Malaysian. Most jobs held by the Malaysian bottom 40% B40 requires their physical presence and cannot be done from home. Roadside food stalls and pop-up morning markets often are mainly of the poorest population income have been ordered shut. These shops are normally enable the poor to purchase food and other necessary at the lower price than in the supermarkets. Rural farmers and fishermen who continue to work find there are no buyers as factories, restaurants, and markets closed. Stop work is not an option for the farmers and fishermen as their life hand to mouth on a daily basis. COVID-19 really been difficult for the poor people in Malaysia. Thank you. Next.
All right, so for the next part, I will be talking about issues and challenges in Brunei. So the main issue initially for Brunei was contact tracing because most of the cases came from the people that had attended the mass gathering in Malaysia. The main cluster of the infected cases were from there, as a total of 81 people attended the gathering. Initially, there were challenges in trying to contact all of the people that attended, as well as the people who have come in contact with those who had contracted the virus. The Brew Health app eventually was managed to be developed for ease in contact tracing in case of future outbreaks. Not only that, foreign citizens who do not comply with Brunei's quarantine and COVID-19 testing requirements may be liable for a fine up to 10,000 Brunei dollar or imprisonment for a period of up to 6 months or both. Any individual found to be in violation of Brunei's social distancing requirements may be liable for a compound fine up to 5,000 Brunei dollar, or they may be prosecuted in court with a fine up to 10,000 Brunei dollar or imprisonment up to 6 months or both. Next is self-isolation facility. Another issue Brunei had to face was the space availability to monitor the suspected coronavirus cases. Due to the nature of the virus, Ministry of Health and Ministry of Home Affairs has decided to set up 4 temporary shelters to combat coronavirus spread, which can accommodate over 1,100 people. Cases with foreign travelers entering Brunei that are suspected of having the virus or have been in contact with confirmed cases will be placed at the monitoring centers. Most of those staying in the self-isolation facilities were students. And lastly, the education package for ease in online learning. Due to the high increase in the number of cases in Brunei back in March, all daycares, kindergartens, schools, and high institutions had to be suspended, hence online learning had to be implemented. The main applications used were Zoom and Microsoft Teams, and as there were a huge number of population having to do their classes online, the telecommunication introduced a package to help those students that do not have internet access at home, and it is called the EduPack. EduPack add-on is a valuable add-on data package introduced specifically for the use of e-learning applications and platforms, which are used by educational institutions for online learning purposes. For your information, there are 39 e-learning applications and platforms that are covered by the EduPack add-on, such as Google Drive, Zoom, and Microsoft Teams.
Alright, so to win the battle against COVID-19, Indonesia needs innovative policies and tactics along with the existing efforts Here are two major points that are worth considering. The first is enhancing the posture of our medical response. So, how medical responses in the time of COVID-19 can be indicated by the availability of necessary equipment such as testing kits, masks, ventilators, thermometers, and etc. Numbers of well-informed and insured medical officers, accessibility of the treatment or hospitals, and the use of artificial intelligence in detecting or curing the COVID-19. Cases such as the use of waterproof rain jacket by doctors who take care of COVID-19 suspects in garages, as there is no longer protective equipment, or the shortage of masks experienced by hospitals in Padang and Penajam Pasir Utara must be responded quickly. Next, please. And the second point is intensifying international engagement. Diplomatic interaction should be intensified with countries who succeed to pass through or manage the COVID-19 outbreak, such as China, Singapore, and South Korea. Keep that in mind that they are the real survivors of SARS 2003 and MERS 2012. Practical recommendations are requesting all ambassadors to partners in their respective hosting countries to support our domestic needs against COVID-19. Facilitation Indonesian scientists and laboratories to join the international network on the discovery of COVID-19 vaccines, inviting international philanthropists to participate in the national effort against COVID-19, enhancing deliberations on traditional medicines to cure the COVID-19, and optimizing the roles of AHA Center in mobilizing international assistance for Indonesia and Asian countries in the time of COVID-19. Okay, next.
Okay, you only have 1 minute more. So conclusion. Okay.
To conclude, it is essential to highlight the importance of the rules regulated, as it is a social responsibility to avoid any outbreaks from occurring in the future. Each country has showed a fair amount of improvements and efforts to help combat the spread of the virus. And that is all from Group 1. Thank you so much for your attention, and thank you for listening.
Okay. Thank you so much for the Group 1 for such an interactive presentation and also informative content. Thank you for sharing some issue and also some challenge that your country is facing right now. And also thank you for talking about smart system on COVID-19. Thank you for talking about expert system as well that has been implemented in your country. I do agree that fast diagnosis of COVID-19 and how to find a patient with high risk is very important. And of course, we need an innovative diagnostic system to fight COVID-19 pandemic. And before we continue to the next group presentation, I'd like to ask all the audience and also all the students joining here, please to turn on your camera. Okay, turn on your camera so I can see your beautiful faces, please. Okay, turn on your camera, please. And now, I'm going to invite Group 2 to present the topic about the impact of COVID-19 on innovation and technology usage from varsity student point of view. In Group 2, we have Fadila Willis from Universitas Airlangga Indonesia, and also Hana from Universitas Airlangga Indonesia, and we have Hang Yu Hong, Muhammad Azizi, Muhammad Haris, and also Siti Shara. Okay. Are you guys ready to start your presentation for the Group 2?
Yes, we are ready.
You are ready. Okay, good. And remember, you only have 25 minutes for your presentation. So please keep your time wisely. Okay. So your presentation can be started right now.
Okay, good morning to doctors, lecturers, and all the participants of this online global classroom. So now we representatives from Group 2 will share some of our opinions based on the impacts of COVID-19 on the innovations and technology usage. Next, please.
Could you please share your presentation slide?
Um, already sharing our presentation slide. Can you see it?
Already sharing? Okay. Okay. Okay, good.
Okay, and next,
Okay.
please. So before I start, I would like to introduce myself first. My name is Hang Yu Hong, and I'm a student from Faculty of Civil Engineering Technology in UniMAP. Okay, next, please. So, okay, I believe that most of us and you know that what is COVID-19. We know that this disease mainly attacks our respiratory system and it could be spread very easily through the air. And it happens very often at places where people are physically close. So it is so dangerous that this disease has caused millions of people to die over the globe in just a few months. Okay, next, please. So it is clearly to see that this COVID-19 is actually threatening our human lives and also health. But not only that, it also brought a negative impacts on our economics and social too. Next, please. So during this COVID-19, I actually suffered a lot, and I believe that you guys too, because it ruined my social activities, disrupt my education, and also slowing down my income. I think this is the worst part of it, right? So, and it also quite challenging for me to always keep an eye on my personal hygiene from time to time. So next slide, please. Okay, after knowing so much about the impact of COVID-19 on our life, perhaps my life, so I will share some of the impacts of COVID-19 on the innovations and usage of technology. So recently, I have studied a research from Catherine in August. She mentions that the innovators are now tends to shape their innovations to be infection prevention. So by replacing human labor with robotics, and they also hope their innovation to be remote commerce, so the things could be done from a far distance. And next, they also hope to improve the resiliency and agility of their innovations, so work could be done quickly and flexible in all situations. So this mostly points the productions line. So next slide, please. Next, please. Okay. So because of the pandemic, people starting to practice their social distancing and cause the works and education activities have to shift from workplace to home, and they started their working from home. People also prefers the technologies with physically contactless and also remotely functions for their choices, and hence this has actually surged the usage in the digital technologies. Next slide, please. So here are some of the examples of the digital technologies I actually used during this COVID-19. So I use these digital technologies for online food orderings, for my online classes and meetings, and also use it for my payments on the food. So next slide. Lastly, I would like to share some UniMAP's innovation during this COVID-19, which is the mobile sanitizing tunnels. So I think this is very a good innovation. For as these mobile sanitizing tunnels, it really helps the frontliners to sanitize themselves from entering or from coming out from the infected areas, so to decrease the risk for getting the infection. So that's all from me. Thank you.
Good morning, everyone. I am Siti Sarah binti Zakaria, Faculty of Electrical Engineering Technology from UniMAP. The effects of the COVID-19 outbreak have impacted almost all sectors of our society. Higher education is no exception. The students face an increasingly uncertain environment, for example, lack of resources to complete their studies, along with the transition to online learning may have affected their academic performance and educational plans. So this presentation will be discussed on the impact of COVID-19, especially for students' life. So this is basically my experiences during this pandemic. First, I think many of us, not just the students, but almost all the people in this world have facing an issue with their network connection. Sometimes I'm facing a poor connection when I'm trying to upload my answers for the test, but it is only happen when I have a test. I think most of the students having this issue, I guess. Then I'm also have a problem in online classes for the calculation part because I think it is more better to have the lecturer physically for the calculation part. So the students need to do more self-education at home or wherever they are. The students cannot attach to each other face to face because of this pandemic, especially for the new intake students for university level. They just can contact via online only for now. Or maybe if their university give the permission to come to the university, they have to follow the standard operation procedure SOP and have to be quarantined. As you can see in the slide, I have included the picture that I make a video call with my friends because we cannot go out, so we just make a video call as long as we still can be contact. Next. As expected, the COVID-19 outbreak also had large negative effects on students, which are the students are missing the days in the schools and college. Like I said just now, they just can contact via online, such as WhatsApp video call and etc. And they may have a problem to complete their assignment because of the physical absence of teachers. However, I would argue that we desperately need some positive among all of the bad news for our mental well-being. Actually, the students get a chance to have more time with their family. In other words, they can help their parents when necessary and make a great bonding between the family. Moreover, the students can use their quality time in studying and the other activities in which they are interested. Spend time in the house by not going out and enjoy watch movies at Netflix, I guess. And for the innovation, next. For the innovation, UniMAP had made an innovation on this COVID-19 that we call it as Update My Location System. As you can see in the slide, I have put an example on how it's works. First, the students need to access the link and then fill in the numbermetry and the IC2 and then click the submit button. So it will display like a picture of number 2, and do not forget to turn on the GPS so the system can trace where you are. Then click the update location button so it will display like the picture in number 3. It will display whether your place are in what zone, red, yellow or green zone. Mine is green. It say that you are in a zone currently free of COVID-19. Please stay at home and practice good hygiene. For the conclusion, although we are in this pandemic, I hope everyone will obey the SOP and stay safe at home. I know we can face it together, and that's all for me. Thank you.
My name is Fadila Wilisrayuda from the Faculties of Advanced Technologies and Multidisciplines from Airlangga University. First-year students at Airlangga University, the COVID-19 impact really gives me a barrier at the start of my campus life. Not only it prevents me to get to know the Airlangga University environment, but also it hinders me from socializing with my fellow students. It might be one of the hardest part to not only adapt to a new learning method and environment, but also the need to adapt to COVID-19 impact to educations as a whole. COVID-19 prevents me to get the usual education such as getting in class or practice in the lab, and prevent me to access university infrastructure such as the library. As the COVID-19 infections grew day by day, the lectures need to innovate into more digitalized environment. Therefore, the educations can still be attended just as more efficient as before. And I will give you the experience of my campus orientations with social distancing protocol. The campus orientation program at the start of the freshman year was held via online meetings. All the ceremonies were attended virtually and with strict COVID-19 prevention protocol. Students are allowed to attend the ceremony only with prerequisites that we need to comply. Only 4 students per field of studies were allowed to hold all the orientations program offline. And we need to comply with strict COVID-19 prevention protocols, such as wearing masks, washing our hands, and no close contact with one another. And then moving on to the innovations and technology that Airlangga University innovate is that Airlangga University creates for the pandemic. Our Airlangga University already on research progress on the coronavirus disease vaccines at the time we present it right now. This is due to the infrastructures that is the specialty of Airlangga University had, and that is the Institute of Tropical Disease, in which focus more on the disease that presents mostly on tropical climate nations such as Indonesia, Malaysia, Brunei, and other Asian nations. Airlangga University also create e-learning system in which the student can access through the websites on the internet. The e-learning website provides students with all their educational needs, such as classroom material, PowerPoint, recording of the lecture of the previous class, and discussion forum for all the students, and task and assignment submissions. Therefore, not only this create easy access for the student from anywhere and anytime, because they are being put apart on their hometown and not present on Surabaya, but also this creates an efficient learning platform for the students, because they don't need to search the material that is scattered through different WhatsApp groups or different internet on another websites. In the platform, it is already collected in one places, so the student already has the advantage of learning and efficiency on learning even in this pandemic time. And that is why the innovations that Airlangga University create has already helped the students to student efficiently. That is all from me. Moving on to the next presenter.
All right, can you hear my voice? Thank you for the time. Hello, everyone. Good morning. My name is Hannah. I'm from Faculty of Medicine, Airlangga University. And in this session, I would like to share with you 3 points based on my thought and experience. Yes. Since the pandemic really impacting student activities and technology usage, as the previous presenters explained, our university also made a facility to help students to access the library without going to the campus. So there we can find any books, any journal, or any studies that can help us to complete our task, especially for me who are conducting my paper. So this e-library was actually made a few years before the pandemic hits, but I just find it really, really helpful because our university also subscribes some, journal databases, so we can access many purchased journal there. Yep, that's just another innovation brought by Airlangga University. The second one came from my own experience facing new global issue, COVID-19 pandemic. Yes, next slide, please. As I back to my hometown in March due to the spread of COVID-19 here in Indonesia, I face a big difference on my daily basis. So me and my junior at medical school thought that it would be interesting if we help each other, especially the health worker and the poor who really felt the impact of the pandemic. Therefore, in April 2020, both of us run this youth community that more focusing on health and education, involving students from even different universities to conduct fundraising, as well as we educate Instagram users with some COVID-19 protocols or just health trivias. And recently, we already transformed the donation into medical devices for health worker in our local hospital. And yeah, we also had time to distributing nutritions, sanitizer, etc. to the families who were affected by the pandemic. Next slide is just a few documentaries from our activities here at a small city. I think we as the student need more action for the citizen as long as we have that role of being agent of change. Yes, next slide, please. The last thing I want to share with you is this newly innovation. As you may know, Dr. Nico had shared his amazing work on robotic health assistant at the first meeting, which was called RISA, that helped doctors and nurses to transport some staffs into the infectious area in the ICU. So here we also have Fenty Robot. And what is that? Yeah, we know that there were a variety of efforts continue to be made by many institutions today. So in the field of technological innovation, ITS here in Surabaya with Rumah Sakit Universitas Airlangga and Dr. Sutomo Hospital as our educational hospital created a low-cost ventilator robot to be expected to overcome the lack of ventilator in Indonesia, as well as we developing vaccine, which Yuda had mentioned before. So this process of making the ventilator was definitely great since the team there were engaging students from both institutions. So if I can say the conclusion, we need to look up to students' point of view, where we can find that it gives not only an evidence of research collaborations, but also a promising solution. And finally, it helps students to explore the innovation and their creativity during this pandemic. So that's my presentation. I'll give time to the next presenter. Thank you.
So, kedengaran? So, hello. My name is Muhammad Aris Mayudin Gabullah. I'm from Faculties of Computing and Informatics. So today, I'll be presenting my points regarding the impact of COVID-19 on innovation and technology usage. Next slide. So the first one is the impact of COVID-19 to students. In terms of financial, from my point of view, it can be clearly seen that COVID-19 brings bad things. So for me, it's a good thing because I can save my money instead of spending it more. And it taught me to save more. So since I'm a guy that always spends more, since I'm the guy that always spends money a lot before this pandemic. But it's also a bad thing for me because I have to pay more on my mobile data than before. Since my Wi-Fi sometimes lag due to many users at home. So in terms of education, I can assure that I spend more time to study, but only for sometimes. My usual time to study is only for like 1 to 1.5 hours per day. But during the lockdown, I have more time to study since there's no exam, changed to 100% coursework. Therefore, I need to focus on my study, finishing my assignment and my coursework. In terms of social, I spend most of my time with my family, but still contact my fellow groupmate for our assignment things and lectures to ask them some questions. In terms of health, students are well prepared and at the same time feared due to COVID-19 cases increasing. So they know that what to do as proposed by the Ministry of Health in Brunei through media social platforms, example ways to prevent from infection, step by step on how to wash their hands and others. Next slide. Okay. So the issues or challenges faced by students during COVID-19 is that almost all students are experiencing a slower internet connection, and that leads to them being lagging behind, especially those who are having an online classes. So the second one is that some students may not have the resources for them to attend online classes, especially the devices like laptop, which is mostly used by those students. And then some of the students may not afford to pay for the Wi-Fi connection, which they have to use their mobile hotspot in order to attend the online classes. So the third point will be is that it's about emotional support, which means some students prefer to be supported. Example, like some of them needed to motivate themselves to work more, especially those who are deeply stressed because of too much assignments and courseworks, and etc. Next slide. Okay. So this is one of the innovation that used in UTB and all premises in Brunei Darussalam, which is the BruHealth. So the BruHealth is a one-stop mobile application created by the Ministry of Health for anything COVID-19 related in Brunei Darussalam. This application was a must for all Bruneians to use wherever they go. This application is also used to collect as well as tracking people where they go. So in UTB, before students enter the building, they have to launch or run the BruHealth application first because they have to update their status every day through doing the self-report. Also, they need to turn on their Bluetooth as well as their location on their phone. Once they've done that, the application will go through some kind of an algorithms. After that, it will show them the color code. If it's green or yellow, then students are allowed to scan the QR code. Once they scan, they can enter the building before they leave, and before they leave, they also need to scan the QR code, which is shown on the number 4, scan when leaving. Okay, next slide. So this is an example where students have to scan the QR code and they have to sanitize their hands, which is provided in every building or premises. So yeah, that's all from me. I'll give it to the next presenter.
Hello. Okay, I am the last presenter for Group 2. So my name is Muhammad Azizi bin Kifli, and I'm from Faculty of Computing and Informatics. So the impact of COVID-19 on innovations and technology usage by varsity students' point of view. Next slide. So personally, these are the issues and challenges during the pandemic that I have experienced. So in terms of lifestyle, we have to adapt the online environment. In terms of studies, we don't have fast response and solutions, meaning making us have to research by ourselves. And lastly, due in terms of financial, due to online environment, we have to prepare financially, such as we need laptop with a built-in camera and microphone, a proper working internet connection, mobile devices, and so on. Next slide. So the impact of COVID to the Brunei students, we have a good and bad impact. So first, I will tell you the good impact. So in Brunei, since we cannot travel and go to places, students and general public are becoming more healthier, as I can see the growing number of people exercising while keeping social distancing. Secondly, students can learn more online as they can search through the internet easily. Lastly, on the good impact, students have been given more benefits as they require to hand in works online only. Even though there are many more good impacts, but there are also a cons, such as that students take advantage of online classes as they can sleep late and just turn on their computers or laptops to attend the online class next day. Students who apply for foreign exchange programs, attachment, and internships are being cancelled. So most of the students are not pleased to hear the news. And due to conduction of online class, some of the students doesn't have internet connection in their houses. Next slide. Okay. So in terms of innovation and technology, due to government fast response to the pandemic, COVID-19 in Brunei Darussalam are very in control. So most of the schools, institutions, and places are being open to public, but nevertheless, we all take precautions. Technology we are using is e-learning. So UTB students made the utilization of Microsoft softwares and learning management system, such as LMS by Moodle, Teams by Microsoft, and the OneDrive for file sharing system by Microsoft. Other institutions also use other softwares such as Google products, Zoom, WhatsApp, and more. Next slide. So I want to touch about the pros and the benefits of online learning versus face-to-face class. So each types of learning has their own pros and cons, but today I will focus more on pros. So in online learning, it offers a more flexible schedule and environment. It is also has a higher retention rate. Online class can also let you learn more, and it requires less time. But in face-to-face class, there will always be an instructor or teacher present at all times to answer the students' queries. Exchange of ideas and views in offline classroom is in real time and effective. The probability of learning is high as there are other students learning along and sharing knowledge, and any doubts and problems can be solved immediately. So that is all from me.
Thank you. That is the presentation from Group 2. I think we should move on to the next.
Okay. Thank you so much for the group 2. You guys are Well done. By the group 2 presentation, we all can see that the effects of COVID-19 are having a significant impact on the technology usage, especially in our daily life. For example, in our teaching and learning activities that have been conducted almost 100% online. And for one of you, Hong Yu-hong, I hope you are not suffering anymore because you are not alone here. You have your friend to be to collaborate or maybe to discuss something about your problem. Okay. Now it's time to move from group 2, and I'm looking for the last group. There are 6 students in group 3. They are Nur Aisha, Reina Sri, Adrian Jonathan, Nilda Maulida, Fuad, and Nur Shifa. So the group 3 will be presenting a topic about innovative healthcare services digitalization for the COVID-19 pandemic disaster. Remember, group 3, you only have 25 minutes for maximum duration of your presentation. So please.
Test 1, 2. Assalamualaikum and very good morning, everyone.
Waalaikumsalam.
We are our topic, which innovative healthcare service digitalization for COVID-19 pandemic disaster. Next. Next slide. Test 1, 2. Okay, we will represent the presentation outline. First, to explain and introduce about COVID-19. Second, to identify problems related with COVID-19 pandemic. Third, to explain how digitization improve the healthcare service to deal the COVID-19 pandemic. And lastly, to discuss how to improve the digitization of the healthcare service. Next slide. Okay, firstly, I want to give some introduction. What is COVID-19? Coronavirus disease 2019, or namely COVID-19, is defined as illness caused of novel coronavirus, now called the severe acute respiratory syndrome. All name is SARS-CoV-2, formerly called 2019 nCoV, which has the first identified amid an outbreak of respiratory illness cases in Wuhan City, Hubei province, China. It is initially reported
to anyone operate the presentation slide, please going to the next page.
It was initially reported to the WHO on December 31, 2019. Okay. Illness caused or substitute of term COVID-19 by WHO. The acronym derived from coronavirus disease 2019. The name was chosen to avoid stigmatizing the virus origins in terms of population, geography, or animal association. On February 11, 2020, the Coronavirus Study Group, the International Committee of Taxonomy of Viruses, issued a statement announced official designation novel virus, severe acute respiratory syndrome coronavirus, SARS-CoV-2. Next. I will explain about the background of the COVID-19 in Southeast Asia. Next. Okay, the COVID pandemic in Southeast Asia is part of ongoing worldwide pandemic of coronavirus disease 2019 caused a severe acute respiratory syndrome. It was confirmed to have spread to Southeast Asia on 13 January 2020 when 61 years old woman from Wuhan tested positive in Thailand, making it the first country except China to report a case. The first death occurred on 2 February involving a 44-year-old Chinese man in the Philippines, also the first outside China. By 24 March, all states in the region had announced at least one case. As of 37 October, Indonesia is the highest number of cases and deaths, ahead of the Philippines in the both aspects. The deaths have been reported in Cambodia, East Timor, and Laos. Then I will pass to next presenter.
Okay, I'm Nilna Molida. So everyone can hear my voice, right? So my name is Nilna Molida. I'm from Universitas Airlangga. So here, based on the introduction, we can give two equations of problem identification. The first one is what are the sectors affected by the COVID-19 pandemic and what are the problems faced by those sectors. Also, we include the solution that have a play in some countries in ASEAN. The first sectors, of course, is community unpreparedness in facing social shifting and cultural shifting. And the solution of that is preparing for the new normal through planning and policy. The second sector is education. Digitalization of education creates many gaps of that. And the solution of that is conduct training to introduce the digitalization. And in Indonesia, the government provide internet quota assistance for academics. The third sector is health services. The WHO survey shows that health services for people who need testing for cases other than COVID-19 have become disrupted due to the increase in services for COVID-19 patients. And the solution of that, many community like create and provide digital-based service. And the fourth sectors is economic. Like social restrictions affect economic activity and people's purchasing power. And the solution of that is strengthen economic cooperation, especially in ASEAN countries. Okay, next please.
Okay, next I'll be representing Malaysia from UniMAP to discuss on how digitalization improves the healthcare services to deal COVID-19 pandemic. Next slide, please. Next slide. Our most popular healthcare services is the MySejahtera application developed by Government of Malaysia to assist in managing the COVID-19 breakouts. It allows users to perform health self-assessment on themselves and their families. The users can also monitor their health progress throughout the COVID-19 breakout. MySejahtera enables Ministry of Health to monitor users' health conditions and take immediate actions in providing treatment required. MySejahtera application is developed to assist the government in managing the COVID-19 breakout, helps users in monitoring their health throughout the COVID-19 pandemic, assists users in getting treatment if they are infected with COVID-19, and locates nearest hospitals and clinics for COVID-19 screening and treatment. MySejahtera is used by Malaysians and residents of the Malaysia System Administrator in the Ministry of Health. The information submitted throughout the application will be used by the Ministry of Health to help them plan their resources and actions that they need to take in order to manage the outbreak of COVID-19 in Malaysia. The minimum mobile device requirement to use MySejahtera is a smartphone and internet connection. One can register for a family member or other individual who do not have a mobile phone or access to smartphone by using the manage dependence function in this app. The application will help monitor their health as well.
The information of all identified COVID-19 patients is protected under the confidentiality of medical records. There are also other healthcare services provided in Malaysia besides MySejahtera, such as the telemedicine apps. Next slide, please. Okay, the first one is Doc to Us, which allows individuals to talk to a doctor or any healthcare professional via text calls, text chat, audio and picture messages to better describe their condition anywhere, anytime. Next is Doctor On Call, which is the Malaysia's first digital health platform founded in 2016 that connects patients with healthcare professionals such as doctors and pharmacists. The company provides teleconsultation services, medication delivery services, and also COVID-19 screening services. Next slide. We also have the TeleMe, which provides effective healthcare experience by connecting patients to health practitioners, pharmacists, and health lab online with a reminder service system and a personal health record, personalizing medical records. And lastly, the Doctor to You that provides four main services, which is doctor house calls, medication delivery, live chat, and video consultation. As such, one can simply have an online consultation or having a doctor make a visit to their home. So that's all from me. Thank you. Next presenter.
Okay, I will explain about the example from Indonesia. Indonesia has an application named Halodoc. Halodoc is an application from Indonesia which is engaged in the health sector. This application was founded in 2016 by Jonathan Sudarta. The goal of Halodoc is to simplify access to health. Patients can easily connect with doctors via smartphone. Next slide, please. Okay, the following are some of the features available in the Halodoc application, which aim to deal with the COVID-19 pandemic. First, doctor chat. With Halodoc, we can consult about various diseases, for example, about COVID-19 without having to make a schedule in advance. Second, register for rapid test and swab test online. Can order a rapid test and swab test schedule online without having to come to the hospital. Third, information regarding health update. Search from doctors who are experienced in their fields or health information ranging from tips, disease information, types of treatment, and other important information about health is presented in full in this health application. Next.
Okay, besides also some universities in Indonesia like provide digital services for COVID-19. So we have a three example for three universities that have provide digital services. The first example is come from Universitas Airlangga. So Universitas Airlangga provide website. The name is covid19.unair.ac.id. So this website have 5 features. The first one is COVID-19 early detection service. So the people can fill the form that can they can be able to know the result that they are in the high, the middle, and the low risk. And also the website will give tips or the preventing action that they have to do after that. The second is information about COVID-19. And the third is referral hospital. So like people want to know about the hospital that they can reach, the website will give the information of that. And the fourth is infographic of COVID-19, of course. And the is contact services. Okay, next slide. The second example is came from Universitas Gadjah Mada. So Universitas Gadjah Mada provide a COVID-19 call center. So this call center service form as an effort to reduce panic in the community in responding to the spread of the coronavirus, especially in the special region of Yogyakarta. So Yogyakarta is the location where the Universitas Gadjah Mada plays. And the third example came from Universitas 11 Maret. So in Universitas 11 Maret, they provide online psychology consultation service. So this consultation service is aimed at Universitas 11 Maret students who are expressing anxiety due to the outbreak of coronavirus disease. So as we know that because of this pandemic, there are increasing number of anxiety and also mental health, and this services is one of the solving of that problem. And it's not just for the Universitas 11 Maret student in Solo, but also in Universitas 11 Maret students in around Indonesia. That's all our Indonesian presentation. So next for the next presentations.
Hi, hello. My name is Fuad and I'm from University Technologi Brunei. And for this section, I will be discussing on how Brunei has digitalized its healthcare services to deal with the COVID-19 pandemic. So as standard with many countries around the world, Brunei has also developed its own contract tracing app in BruHealth. So the app is based on the Ministry of Health website called healthinfo.gov.bn, and it also integrates digital healthcare services. So as their slogan states, the application's main aim is digitalizing your healthcare experience and empowering you to better understand and manage your health, together towards a healthy nation. So next, I will be highlighting a few innovative features of the BruHealth application, which includes video consultation appointments and also a COVID-19 self-assessment tool. With the video consultation appointments, users can book appointments through the application for doctor consultations through video call without having to be present at a hospital or clinic. On the other hand, the COVID-19 self-assessment tool allows users to assess whether they are infected with COVID-19 by providing information on their symptoms and conditions. So in this slide, I will be showing an in-depth look of the self-assessment tool. So firstly, users will get this message prompt. Next, they'll choose from the responses given for symptoms and conditions. They'll also provide information regarding epidemiological history, and then they'll be given a summary of their details provided. And lastly, this is the resulting self-assessment report. So next, evaluating the impact of BruHealth. So firstly, as of June 2020, 400,000 individuals or 87% of the national population have registered for BruHealth, while 10,638 companies and premises have registered for the application. Second, digitizing healthcare services has reduced the workload strain on frontliners and limited workforce in the healthcare sector, while continuing provision of non-COVID-19 related services. And lastly, the contact tracing technology through BruHealth has allowed members of the public to carry on with their daily activities while making it easy for the government to track COVID-19 cases. Okay, so another way in which Brunei has digitalized its healthcare services is in the way it is providing information to the public regarding COVID-19. There are two notable channels, which are the National Health Advice Line and the Ministry of Health website, which includes official information and statements on directives, guidelines, and myths and facts on COVID-19. So now on my final point of discussion, which is a press conference conducted by the Ministry of Health. And through these press conferences by the Minister of Health, they have been providing daily updates on the current COVID-19 situation, which is broadcasted not only on national television and radio, but also on social media channels such as Instagram and Facebook. So in this way, the government has emphasized on the values of transparency and accountability on the response to COVID-19, which has helped gain public trust, which is an important strategy in governance in the face of a pandemic. So now I'll pass on to the next speaker to discuss on the next section.
Assalamualaikum and greetings everyone. Shiba Ismail from University Teknologi Brunei here. So my fellow teammates are done with their presentation on the efforts of each country in order to aid the public with their healthcare necessities during this pandemic. So let's recap back on what mentioned earlier briefly. This is the summary. So the first one, basically ease of contact tracing. This has been mentioned from the start of this webinar, where we are now required to scan a code in order to enter and exit any premises. Second one, the public consciousness, or in other words, awareness. 3 out of 3 countries are currently actually showing their attempt to educate the public regarding the development of COVID-19, especially nationwide. As example taken from previous slide would be the daily press conference. Next, all of these initiatives also provide the public a safe platform, as example, the public advice line to share the concern to proper parties. Lastly, of course, the obvious implementation is introducing healthcare services at our fingertips. How we now have access to our medical records digitally, book an appointment online, and so on. Next slide, please. So despite all the positive sides of it, now we discuss the limitation of the executed development. Firstly, as almost everything is conducted online, we now need internet, and so the problem arises specifically in rural areas, where internet connection is the concern in this case. Other than that, setting up internet wouldn't be the best choice in short amount of time, as it requires more expenses here. Second one, adapting to the new norm. Adapting to the new norms connects to generational differences. Before we go further to that, let's just be frank that adapting to new changes are not easy work. From how our healthcare services workforce are required to attend training on the new implementation to the healthcare system, and same goes to the public, where we now need to adapt to the new online services. And hence, we now go to the generational differences. The main target here is, of course, our prior generation. Then lastly, about affordability, it is still one of the limitations here. Although there are a number of donations provided by the general public or government to help in providing refurbished laptops, not all families are able to afford it. Not only that, some people may have their own gadgets. However, their gadgets may be outdated and cannot support the application that is used by the public to date. Example, in Brunei, not all mobile phones can support the Bru Health app. So to conclude, next slide, please. So to conclude, these are the impact of COVID-19 on our current healthcare system. First one, efficiency. Now we have a centralized database to store all the patient data. Next, less reliance on paper-based documents, which help us to reduce loss of data. And lastly, the usage of online virtual platform, which reduces physical contact. And that is the end of our presentation. Thank you so much for your attention.
Okay, thank you so much for the group 3. Your presentation is really nice. And thank you for sharing some information about innovation on your country and about healthcare system and also digital healthcare system that currently being used in your country. And before we have a Q&A session after this by our reviewers and also question answer session by the audience, let's take a break for 5 minutes, please. Time is up for interim break. Now we will move to the Q&A session by all the reviewers. Please note that each reviewer is only allocated for 10 minutes for question and answer session. And also, for all audience here, joining here, during this session, you are allowed to submit your question on the chat box. So don't hesitate to give a question for all the groups from now on. We will choose a suitable question and address it to the specific group later. Without going off ado, now I will pass this session to Mr. Muhammad Shufino Zuhaili as the first reviewer to give a question, maybe a review, comments, or suggestion for all the groups. Okay, to Mr. Shufino, I will pass this session to you.
Thank you very much, Ika, and Assalamualaikum and a very good morning to all of you. That was a really good presentation that was given to me, and I really appreciate what was actually being presented there. Overall, I would like to say, like this is a little bit casual session, so thank you very much on your presentation, and I hope that you all are having a good time during this COVID-19 situation that we are facing. So the first Q&A, I think for the first group that I have is that you did mention issues and challenges that are faced by your countries, and I noticed that most of the solutions that you are given are not actually related to to your current problems. That's for group one. And for group two, I think you did mention the bad, but I kind of like want to know what you are going to do about the bad thing that is actually happening to all of you. For group three, I think it's quite good. Your presentation was really nice, and the way that you actually give other point of solutions and so on regarding the situation that you are facing, especially during your problem identification part. But most of the solutions that you gave also didn't mention what are you going to do for that problems that you are facing there. So those are my Q&A for each of the group, and I'm willing to hear what kind of answers you're going to give to me, and I hope the answers are really great. Thank you very much. So I think we'll start with group one first.
Sorry for disturb. Can you repeat the question
For
for
group one.
group 3? Thanks.
For group three, is it? For group three, I think I would like to know in the part where you put your problem identification, you give a solution, but what kind of solutions is that? It's very general per se. So, what are your thoughts on that?
Good day, Doctor. I'm from Group 1, Tinggalan from UniMAP.
Okay, good. Hi, Tinggalan. I think you are the one who says social issues and economic pressures, right?
Yes, Doctor.
So, what's your uptake on that?
So what I feel is um, finding a vaccine for COVID-19 could be the solution for all these problems, first of all. And then as a new norm, Malaysian should adapt to this environment, and inventions like holographic invention may be able to help the residents in Malaysia to overcome this problem. So it's something futuristic, and scientists are still developing that holographic technology. So maybe this might help the socialization among Malaysians and all other countries in the world. And the state of economics, I think we have no left choices than creating a new platform for the farmers and also the entrepreneurs to sell their products so that they can survive in this world too. Thank you, Doctor.
Okay, great answer there. Good job there, Tinggalan. And that's a good answer. Maybe your suggestions you can actually put into your own write-up, because that's actually a good suggestion. So, how about group two, group three?
I will answer the question for the group two about the bad side when it comes to our habits when virtual learning. So our experience on the bad side of the actual learning was actually more or less on the adaptability of us. For example, like the student take advantage of online class as they can sleep late and just turn on their computers or laptop to attend the online class the next day. I think it is come from from ourselves that we need to adapt. But by time we can afford more on adaptability on how to be more effective online students as of how by not sleeping so late and being ready for tomorrow. I think the solutions for this cons is that we just need to adapt ourselves, and it will we will adapt going on with through times as we become more adaptive on this. I think that is all the comments from me about the question for the group 2. I think, and thank you.
All right, thank you, Group 2. I think it means that you are suggesting a way to change habits and behavior in that sense. And I think that's a good answer. And I think so it's some form of recommendations that I can give for you to actually include in your writing. So what about you, Group 3? How are you?
Bismillahirrahmanirrahim. Assalamualaikum, Doctor. I'm Nur Aisyah binti Muhammad Noor from Microelectronics UniMAP. Okay, based on your question just now, what part of the solution that the healthcare digitization has done right, if not mistaken? Can you repeat?
If you notice that you actually put a solution for your problem identification, right? So you are suggesting like policies, you're strengthening economies, provide digital-based services, conduct training. So how are you going to do this? What kind of solution? Is it a platform? Is it a new form of technology? Is it a new form of legislation, benchmarking, and stuff like that?
Okay.
Okay. Mr. Sufino?
Yeah.
Okay, I think it's done for the Q&A session 1.
Can I wrap up, Alice?
Okay.
Okay, I will wrap up because I only have 10 minutes, and I will wrap up. Most of you are focusing on the current now of the post, which is during COVID times. But I think some of the suggestions that I can give is post-COVID situation, like COVID fatigue that the population is going through, mental health issues, and a lot of economic stimulus, and what kind of stimulus and economic platforms that you can actually do. So those are the things that I think some of you might actually try to include in your studies and whatever innovation and solutions that you are going through. So I would like to thank our moderator, which is Ika, I think. Thank you for giving me some time to actually give some summaries there.
Welcome. Okay. Thank you so much for Mr. Muhammad Shufino Zuhaili for leading the Q&A session 1. And here, the second Q&A session actually will be conducted by Mr. Yosaimi from UTB. Hello, Miss Yosaimi.
Yes. Hello. Good morning.
Are you already here?
Yeah,
okay.
I'm ready.
Now, I will pass this session to you, and the allocated time for this session is about 10 minutes.
Okay. Thank you. Good morning, everyone. Well done to all the students, all presenters. Well done. Really informative. Okay, I have 3 questions here for one per group. So group 1, I actually posted the question in the chat. So group 1, now how do you think that the authorities should do to combat the misuse of technology or system? Example like spreading of fake news. You know, fake news is quite can create panic, right? So how do you actually combat that? Can you get group 1 to do it?
Hello, I'm a representative for Group 1. I'm Anissa from UTB. So in my opinion, I think the authorities should always monitor these platforms that would often spread fake news or would be often used as a source of providing information. For example, in Brunei, on Facebook, we have this particular group called Brunei FM. So in my opinion, I guess authorities should focus, for example, in that group, in case there are any false information that is being spread. Or we could ask the general public to always be aware if there are any false information being spread. They should immediately contact the authority saying how there's false information being spread online. And also to constantly remind the general public the consequences if they were to spread false information, such as what kind of law that could be prosecuted against them if they were to spread false information.
Yeah. All right. Thank you very much. Thank you. So group 2. Now, in your opinion, right, should we continue the new norm in the context of university? in the future as when there's no COVID-19 anymore?
I want to answer the question. In our opinion, I think the innovations that being made in the pandemic actually accelerate the digitalizations of our education system. And when the COVID-19, when we are free of COVID-19, I think the innovations can be changed not only into the COVID-19 prevention infections, but also things in our life, and therefore I think it can supplement our way of life but not changing it. It can supplement our way of life to be better in the future, even if the COVID-19 is already free of infections in our respective nations. That is our opinion. Thank you.
Thank you. Would you prefer online or on-campus study?
I think when it comes to learning, I think I prefer offline, but when it comes to the learning materials and all the recording, I think the online innovations that we create in this pandemic really can help us in the future. I think that is from our opinion.
Okay, thank you very much. For group 3, now, in your opinion, what should be improved in the current healthcare system in dealing with this pandemic? What should be improved in the current healthcare system in dealing with this pandemic?
Okay, I will answer that question based on application from Malaysia.
Okay, go ahead.
Can I? Okay.
Sure.
Based on our main application in Malaysia, which is MySejahtera, the part should be improved is about the hard part. I mean, it's already done by Indonesian application, which means I suggest that Malaysia should have that part also, because during the pandemic we just not face on the coronavirus also. Based on virus only, but because of the the department must include on the MySejahtera app.
Is it done?
I'm done. Sorry.
It's a bit lagging, I think so. Now, first of all, I like to congratulate all the students. Well done. It's very informative. You shared for sharing your experience and challenges you faced during the pandemic, right? So, and well done. We have to learn to adapt the new norm. No matter we like it or not. Thank you. Thank you for giving me this opportunity. Thank you.
Okay. Thank you so much, Mrs. Sayame, for the important question to all of the group. And now we are going to the next session, Q&A session that will be delivered by Dr. Nico Azhari Dayat. Hello, Dr. Nico.
Hello.
Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Can you remember that the time for this session is only about 10 minutes? So please.
Right. Okay. Good morning, guys, everyone. Group 1, 2, and 3. Allow me to use the guideline that the staff given me yesterday, and I have write some of the review for group 1 and 2 and 3. I think that you all should know about the evaluation criteria, and the evaluation criteria is the shape of the problem identification, and throughout idea exploration, suggestion and recommendation, teamwork, presentation skills, presentation media. And I declare that you all are great team. And for group 1, the information is logical manner presented and easily followed. And for group 2 also logical manner and presented logical and also easily followed. But I think you need to go deep on the number, because I think one of you, I think, already mentioned about the number and the burden issue, the challenges. Go deep, then you get a better marks. And the idea and exploration and quality content, I think it is a novel idea, yeah, for group 1, 2, and 3. And also for suggestion and recommendation, you are given the good quality proposed solution, but this is not the maximal mark, but it's sufficient evidence to back up the proposal later on, that if you are working on the project of technology to help the healthcare fighting COVID. And for the teamwork, you have shown the good teamwork, and specifically for presentation skill and presentation media, I like to, if there is a beginning and developing and accomplish, I think you all guys is accomplished, done this teamwork of sharing this concern, such as like for group 1, I respected, and you brought the EduPact as an education learning, Zoom and Microsoft is good, and for the idea that point idea, innovative policies and intensifying that, I think it's Satya. International engagement, I think it's going to be effective, since it is a global problem, not the local problems. And for the second group 2, I agree with changing student perspective, so that the students not only sitting in the classroom doing nothing, but they have to encourage themselves to build projects, impactful projects. I agree, and also I impressed with the Brew Health. It's a good thing to do with one-stop mobile apps, but you have to explore it more. And I think that's all my review. I don't think I need the question and answer, because they have already answered my question. Thank you, Ika.
Okay, thank you so much, Dr. Nico. So there is no question for each group. Okay, and now for the last Q&A session will be led by Mr. Yutaka from SIT Japan. Without going off ado, I will pass this session to Mr. Yutaka. Hello, Mr. Yutaka.
Miss Ika.
Uh-huh.
Miss Ika, I believe perhaps Yutaka-san haven't joined us. Perhaps we can go to the Q&A session by the audience first.
Okay.
All right, thank you.
So let me check the chat box first for the all question from the audience. I think here we have one question from Ranjini for the group 2. So the question is, we actually that sanitation tunnel may irritate and harm eyes and skin due to the disinfectant used. Therefore, what measures can be done to avoid this situation, and what type of disinfectant is used by UniMAP for the sanitation tunnel? I think this question is for group 2. So anyone from group 2, could you please maybe one of you can answer this question?
Yeah, hello. Okay. So about these questions, so I actually didn't know what disinfectant is used by the UniMAP, but since you say since WHO have mentioned that this sanitization tunnel may irritate and harm the eyes, so I suggest maybe we can still use this tunnel, but we change, instead of spraying the alcohol, maybe we can use UV light, install UV light as another alternative methods which can kill the virus without using the alcohol or the disinfectants. So that are my suggestions.
Okay. For the group 2, any additional answer for the first question? Maybe from another member.
I think when it comes, I want to give some insights to the sanitation tunnel. Maybe when it comes to sanitation tunnel, it is not as strong as it was in for the frontliners that dealing with the COVID-19 patients. I think it is more not that condensed on the alcohol level, and also when yeah, yes, it can irritate and harm eyes, but I think the facilities can provide some face shields, and also we are being clothed when we come into the sanitation tunnel. But the thing is, the sanitation tunnel is not gonna be used as often as we may think, because we only go outside because when it is very dire, when it is emergency that we need to go through outside. So I think even if there is harms in the sanitation tunnels, it is not as gonna be as frequent as we might think. That is our answers on these questions.
Okay, thank you for the answer for the group 2. And actually, this is the second question is also for the group 2 here. I think this question can be addressed to each group, group 1, group 2, and group 3. Started from the group 1. What other facilities or safety awareness can provide in public places other than masks, hand sanitizer, and temperature checker in order to avoid pandemic effectively? Where is group 1? Guys, in group 1, this question is for you, and also for the group 2 and group 3.
I think from my point of view for the safety awareness, we know that in Indonesia, we have this thing that is called a distancing, distancing for about 3 meters or minimally 1 meters against each other. So instead of maybe you will have your mask done, facial or blah, 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 many more. Yeah, but we also need to condense ourselves so that we can, if we contacted with each other, it will not be a direct contact, but instead there will be distance between one each other. You know what I'm saying? So like between me, maybe, and my teacher for the future, the way I speak to her or him is that with a great distance, so that if any of us has sickness or illness, they may be the spread of the coronavirus. It doesn't spread directly to the teacher, to the subject we are speaking with. I guess that's.
Okay, thank you for the group 1. Now the turn for group 2.
Okay, I will present some insights from our group. Is that I think we conclude that there are three prevention methods. The first thing is that yes, it is the direct preventions that can be helped as with us the individual, such as wearing masks or using hand sanitizers or temperature checkers, but also there is indirect preventions that we have told in our presentations, such as the location trackers on where we are located, whether or not it is on red zone, yellow zones, or green zones. And also there is the limit of people into closed off building with closed off air circulations. But with these two, I think it is enough for the preventions. But also there is the third methods, that is the medical interventions, such as the isolations of the patients that is being infected by COVID-19, and also the close off of locations that has been visited by the positive patients of COVID-19. So the locations such such as restaurants, cafe, or other things will be closed off for 3 days and being disinfected with alcohol. So therefore, when it opens, it doesn't infect other customers that visit the place in another days or in another weeks. I think that is all the preventions that we and the state can do to prevent the infections of COVID-19 further. Thank you.
Okay, thank you for the group 2 for the informative answer. And now for the last group 3.
Okay, my name is Nilna Maulida from Group 3. So, based on our opinion, so there are any three things that we have to apply other than using masks, hand sanitizer, and also like makes and hand sanitizer. So the first one is we have to keep the social distancing. Like in Indonesia, like people they want to go to like a restaurant, especially like they have to keep distancing. Like the restaurant have give the gap between the one people to to other people. And the second is keep cleanliness the area. So it's so I think like the pandemic, because of the COVID-19, we have to keep the hygiene of the place. So we think that the public places or the places that have to keep the cleanness with like using disinfectant or something like that. And the third is like they have to limit it, the visitors to come to the public area. So I think like in the before the area can be visited by 50 people, let's say. But right now, because of we are in the normality, we have to reduce it, become to 25 or like that. So why? Because we have to keep the gap, we have to keep the social distancing and the physical distancing. So there are our opinion from Group 3. Thank you.
Thank you for the group 3. I think the main point of this answer is to keep hygiene and also to keep distancing. And for here, I got one question from Wahyu Febrianto from University of Airlangga here. Actually, this question is from for group 1. What formula is recommended by your group to fight COVID-19 for a long-term planning?
Can you elaborate more what you mean by formula?
It's okay.
So could you please describe what formula recommended by your group to fight a COVID-19 but for a long-term planning or maybe for long-term usage?
Or do you mean formula like vaccine?
No, maybe do you have any strategy?
In my opinion, I think it all depends on the people in that particular country. For example, the people in Brunei, we really followed through all the guidelines given by our Ministry of Health. We basically tried our best to listen to what is being told to us, and we were always constantly reminded during every press conference about the updates of the cases to follow through all the guidelines and make sure to not do things like mass gatherings, and we make sure to listen to what is being told by us, like doing social distancing and practice personal hygiene, and basically always constantly cleaning our hands, make sure our hands are clean, and using hand sanitizers and all that. And the main reason why I think Brunei is doing fine is because we really did not do any mass gathering. And yeah, that is all.
Anyone from group 1 maybe can add something?
Yeah. Hello. Yeah. As for my opinion, I think World Health Organization has just released an article for the COVID-19, and they stated as COVID-19 will be there forever until maybe for the next 5 or 10 years. So until we find a vaccine for this COVID-19, the COVID-19 will be there. And even after finding the vaccine, there will be patients affected by the virus, but we got the solution already. Like for example, we have the previous pandemic like SARS. So this is a good example, and that's how I conclude the question.
Okay, thank you for the group one. I think we don't have a question again for by the audience here. So I'd like to ask Mr. Yutaka. Mr. Yutaka, already here or not? Okay. For all the audience joining here, if you have a question for each group, please type on the chat box here so I can address the question to the specific group. And also, I'd like to thank for all the audience for the question and also for each group for the answer. I see. I got information that the head of reviewer today will be assigned to Mr. Muhammad Sufino. Okay. So do we need to take a Q&A session again, or just moving to next session?
Perhaps we can answer one more question from
One more question.
Une Neona in the chat box for
I
all the
see.
groups. Yeah.
Sorry.
After that, maybe we can invite Mr. Sufino to comment for the overall as a head of reviewer. Yeah. Thank you.
Okay, thank you. Here we got one question more. For all groups, we know that there are many challenges in online education, and based on your perspective, how to solve that, especially for rural people, and the people who have limited access on internet. I think you all guys already mentioned about the internet problem in your presentation. So this is the time for you all to give your opinion about this problem. Started from the group one.
All right, I'm gonna take this answer from. So basically, you see, there's many of us, especially in Indonesia's, where they live in a very restricted area where there's no Wi-Fi, no internet, no nothing, and it's gonna be hard for them to study, especially to join online class, like for example Zoom or just like this. So what I would know from my father is that until today, the Indonesian government has given free access to some of those people who are in need, to those students who are in need, especially in the case of a online education who doesn't really has the money to buy up the quota or maybe to access internet maybe. So to all those students, they will be registered on their campus and be told if they are, let's say, are purely enough not to not buy, to not qualified as a student who has internet. And so basically, the governments from Indonesia may give them a sum of help by giving them free access. That's what I think.
Okay, thank you for answer. And how about the group two? How do you face this problem about internet problem? For the group two, anyone from group two? Maybe will be answering this question. So please. Where is the group two, guys? Are you still online here?
Okay.
Yeah.
Yeah. Hong,
Okay.
my friend Hong from Malaysia will answer this question.
Okay, good.
Okay, so actually, I basically myself I didn't face this kind of problems, but and I think that if there is any methods, I think maybe students I recommend that maybe they can go search for friends and relatives or families who have internet access in their home, so to lend their internet for accessing their classroom like that. So and maybe for teachers they can upload videos. They upload videos on the internet. So when they can download it all the videos and one at a time, so they can refer to the videos when whenever they need to learn something like that. So that's my suggestions.
Okay, thank you for the group 2. And now for the group 3. Group 3,
There's
the
one,
do you
two,
have
one, two.
okay.
Okay. Today I will answer about Nina's questions based on UniMAP initiative. Okay. Firstly, from UniMAP itself, we already allow the student who have a limit internet access to come back to our campus and use the facilities. And also they already update the quota, the speed of the internet from 2 Gbps to 10 Gbps just for internet class only. Secondly, UniMAP also already do an initiative which is they had already made two types of class. It's synchronous and asynchronous. When synchronous, the lecturer will do a face-to-face session like us right now, and then but they will record uh, all the meeting and also will put on the Google Classroom. So anybody who have limited internet, especially in rural area, they will you can see back on the Google Classroom if you have internet after that. And also, and who when your area or your hometown didn't have any internet access, and you in green zone, you are allowed to back to the campus, and UniMAP will fetch you at your hometown. Thank you.
Okay, thank you for the group 3. I think it's no question again from the audience. Okay, thank you so much for the audience and also for the answer by group 1, group 2, and group 3. Now we are moving for the next session for overall comments about this program that will be delivered by Mr. Sufino. As a representative, as the head of the reviewer from UniMAP, please, Mr. Sufino, give your opinion about this program. You are given 5 minutes from now on. So please.
Hey, thank you very much, Ms. Tika, for moderating this session. And overall comment, great answers, good answers from all of you. I think you did a good job on looking into the problems and answering questions regarding the current situation of COVID-19. But like I said before, after my Q&A session just now, maybe the things that you should consider or look into in terms of innovation and technology would be the post-care. Because even though once even like, for example, the vaccine is found, how do we restart our lives again? And even in terms of the frustration, in terms of the economic issues that we are facing, and health and social and so on. So technically, we have to look into that also as a part of COVID-19 post-care, Because whether you like it or not, all of us, I know some of you are facing this COVID-19 fatigue, where we are kind of tired of this whole virus and pandemic issue. And sometimes it's good to look into technology, to use technology and innovation, to look at it in this kind of a perspective, especially finding a solution. And I think some of the things that you might need to take into consideration at the end of the day, also in terms of mental health, because I see a lot of the healthcare is focusing on the physical health of the patient and the participants, but none have actually touched on the mental health state, because you have to remember, this engagement that is that is faced by the population actually cause a lot of mental fatigue that is happening. So I think overall, I really appreciate all your opinions, your answers, and even Ms. Ika in moderating the session quite thoroughly. And therefore, thank you for your attendance and participation here. And I would like to say maybe like have a good day. And I hope all of you are not facing any forms of COVID-19 fatigue. I know that most of us are quite tired of the screen. Yeah? Even for us here, like for example, for me, I'm actually quite tired of the computer screen. I'm wishing for more interactions with students such as you guys. And I hope maybe we can see each other face to face after the COVID-19 situation. Maybe one day we will see each other again. Thank you very much, everybody. Thank you for your participation.
Thank you so much for Mr. Sofino for your important comments for the group 1, group 2, and group 3. And let's we move to the next session. In this session, I'd like to give a chance for group 1, group 2, and group 3, respectively, to express anything regarding this program. Each group only has 5 minutes to deliver your overall comments. Started from the group 1. Hi guys, in the group 1.
Hello.
Okay, could you please share your opinion about this program? Maybe what do you feel after joining this program? Anyone, whoever would like to share your opinion or express anything about this program. So please.
So from my opinion,
okay.
from my opinion, alhamdulillah, it has been great. This participation from all of us has been successful, alhamdulillah. And I really thank for everybody, really thank everybody who show up and actively join this discussion, not just us, but to other 30 more people who really sees us and to see us presenting to y'all. And really think that we have done a great job. We have done a fantastic job on our own explanation on this specialty discussion. And I hope that, just like one of you said, we can be the agent of change, so that maybe not tomorrow, maybe not the other day after tomorrow, but somewhere in the future, that we will be a great man, we'll succeed, our name will be in the history, and maybe someday our grandsisters will really respect us, and hopefully that our nation can be brought to its primest time of era. And I hope that in this COVID-19, we can adapt. I know we all have lost so much. I get it. From the bigger picture, the world has really put us down, especially on the economy. We see many people lost their jobs. Some people lose their lives, maybe. That's very, very disturbing to see, especially when we know that COVID-19 will live among us for 5 to 10 years, just like one of my friends said. So I really hope that we will have a healthy life for the future, so that we can strengthen our link towards each other. Maybe, just maybe, if I were the ambassador of Indonesia, I will contact you all to make a greater association to bring up this country and your country to be more famous and maybe acknowledged by others, not just Americans, British, and blah, blah, blah. And I hope, lastly, I say, inshallah, if we stay strong together, we will fight and win against the COVID-19. Thank you.
Okay, thank you for awesome opinion from Farhan from Group 1. Now it's the turn for Group 2 to deliver overall comments in 5 minutes. So who will be delivering?
I will deliver the overall comments.
Okay.
Okay. I highly grateful of what we done here. As students, we are the agents of change on our each respective university. Not only we come here to discuss the innovations that has been made from our university, but also we share our own experience about the COVID-19 impact on our daily life and education life as a whole. These events creates collaborations and understanding on how we tackle hardships in this pandemic. Creative ideas through brilliant young men across different countries. With this, we nullify the barrier of geography and time zone so that we can exchange our idea. I may want to talk on behalf of all the participants here. I want to say thank you for the opportunity to moderator and staff gave us. We were able to present our innovations in front of professors from different backgrounds, and also on behalf of all the participants here, we want to say thank you for Professor like Mr. Muhammad Sufino Zuhaili bin Muhammad Sufyan from UniMAP, Dr. Nico Azhari Hidayat, Ms. Yosai Mei from UTB, Mr. Yutaka Furuya from SIT Japan, and Professor Dr. Tunku Salhat Tunku Ahmad that allocated their time and effort to inspire us, the young generations, on exchanging ideas and help to create a world into a better place. We really appreciate the help and build us into a better students of the future. I also want to say thank you so much to all the presenters here that have put effort into their presentations. I know we have a busy schedules, especially in current pandemic time, but the presenter of each group already allocated their time to create presentations, discussed with their groups, and also did rehearsal before this event take place. I hope our efforts are not pointless and will help to shape us to better students in the futures. And I want to quote from proverb that if you want to go fast, go alone. If you want to go far, go together. Please remember this, that you are not alone and we are going through pandemic together. Thank you. That is my overall comments for these events. Thank you.
Okay, thank you guys for the group 2. You are really, really amazing and awesome. Good job, guys. And for the last turn, for the group 3, who will be delivering? I will give you 5 minutes. Or I just maybe I can. Could you please, anyone from group 3, maybe from UniMAP or UTB, because the first and the second group, the representative are already from Universitas Airlangga. So I want to hear anyone from UniMAP or maybe from UTB, from the group 3, to share your opinion about this program, or maybe what can be inferred or what should be improved for the future. I'm also wondering about your feeling. You have presented your ideas after you collaborate together with your friends from different countries.
Okay, I'm Renushree from UniMAP, so I'll be representing Group 3. Okay, so my opinion of this program is it's been an eye-opener for all of us, since we've been in our own country and the only thing we see is what's happening in our own country. So when I'm seeing this program, I've noticed there's so much improvement in other countries that us as Malaysians we can learn from. We can adopt their innovations, their technologies as well. And plus, looking at the situation right now, people are having a very hard time since they are losing job, many retrenchments, and all these things are very sad actually. I'm really hoping that this pandemic would be settled soon enough, and all of our cooperation is much needed. And looking at this, people using technologies, we can't expect everybody to have access or their literacy towards this technology could be high. People of these older generations might have difficulties using smartphones or having the access to this modern technological world. So it actually takes time. We need to be cooperative to guide them along. We cannot leave them as what they are because they are also an individual in this world. So I hope that all of our cooperation and we need to follow SOP, which is our social distancing, and we hope that this pandemic would solve in a very smooth way, and people are living happily and healthy. Yeah, that's all from me. Anybody from group 3 would want to add on? You may proceed.
Okay, anyone from group 3 will add something? Actually, I have one question from you guys in group 3, and also maybe for the group 2 and group 1 also. I'm wondering, do you have a group chat or something like that to maybe to maintain your collaboration or your relationship for the future? I hope you guys not only until this program finishes, I hope you can maintain your relationship and then your collaboration each other. Although this program maybe will be finished soon.
Yeah,
Who
so
will
far,
be answered?
yeah, so far they have the participants group in the WhatsApp. Perhaps we will move them into the alumni group so that they can have the more contribution to our next students, next group as well. But I think what Ms. Ika said is actually very correct. We should have elongated or for because it doesn't end here, right? So we can have more relationships prolonged in the near future. All right.
Okay, thank you. I hope you guys can maintain your relationship after this program, and also maybe someday we can have a face-to-face after this pandemic ends. Okay, thank you so much for all the groups. Good job, guys, and well done. I'm really glad that to see your teamwork, your collaboration, as well as your cooperation during this online global classroom. And now, sadly, now we are almost at the end of the program. So that I will invite Associate Professor Dr. Tunku Salha Tunku Ahmad, Director of Center of International Engagement, University Malaysia Perlis, and also as a representative of the host university to give a closing speech in 5 minutes.
Thank
Dr.
you.
Saha,
Yeah, thank you very
yes,
much,
I will
Miss
pass
Ika.
the station to you. Okay.
Yeah, thank you very much, Miss Ika. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good afternoon to everyone who is joining this session today. Alhamdulillah, I can see great commitments and great efforts and great enthusiasm by the participants. We can see that just now, and it is a very good platform that the students have the opportunity to share their ideas and views. And first and foremost, I would like to take this opportunity to thank and congratulate the organizing committee of this online global classroom on innovation and technology. From each participating university, I will mention it here. Universiti Malaysia Perlis, thanks to my team, Dr. Arthur, Madam Juliana, and also Mr. KJ Kari Johari for the great session today, and to UNAIR team, Mr. Chahya, Ms. Chitra, Dr. Nico, and also from UTB, Dr. Zaina, and also from SIT, Shibaura Institute of Technology, and from UTM, Dr. D and her team, for making this OGC presentation day a successful one. And the most important thing is our thanks goes to the participants and also the audience. Well done to the participants. Not forgetting the reviewers for this program, Mr. Sufino, Dr. Nico, Miss, let me check again so that I will pronounce it correctly, the reviewers. Okay. Mr. Sufino, Dr. Nico, Miss Yu Sei Mei, and even though Mr. Yutaka Furuya cannot be with us, thank you again for all your comments and also your review on the program. The audience, right? The audience of the program. And for your information, the theme for today's presentation is Innovation and Technology in the COVID-19 pandemic era. And we all know that this pandemic has triggered an unprecedented demand for innovation and technology, including the digital health technology solutions, and it has revealed, and so far we can see successful solutions such as for population screening, tracking the infection, prioritizing the use and allocation of resources, and designing targeted responses. So following the start of the COVID-19 outbreak in January 2020, countries in the world have implemented a wide-reaching strategy to control and contain the virus. With various available technologies, we can actually play a very positive supporting role in fighting the current virus. Technology has provided innovative solutions for medical requirements. On top of that, ladies and gentlemen, this pandemic has also increased the internet resilience and its capacity in most of the countries in the world. Digital technologies and the internet facilities have been improved and enhanced to support the sudden and increased demand for remote applications and transforming technology capabilities to enable continuous work and study while supporting epidemic prevention during the pandemic for tens of thousands of households. So based on the global developments, it is forecasted that we will go through a lengthy period before we can be completely free from the threat of COVID-19. The fear of coronavirus has confined people as a means of slowing down the spread of the infectious virus. The practice of social and physical distancing, wearing face masks, sanitizing hands, and checking body's temperature have been the SOP in the workplace, shopping centers, universities, markets, in order for us to prevent the spread of COVID-19. So it is likely that we may not have a chance to meet in person for some time, for now. So I would like to extend my heartfelt regards and wish all of you the best of health and prosperity wherever you are. I hope that we will continue to work and cooperate in these virtual collaborative settings. Hopefully we will have another session soon, maybe by early next year. This virtual program has benefited many, especially the students, because of its low cost compared with physical or face-to-face mobility, and it is accessible to many, many more students. Last but not least, ladies and gentlemen, I hope that all of us will continue this partnership by organizing more attachments in the future, including extending this to a wider range of higher learning institutions in Malaysia, Brunei, Indonesia, Japan, and the rest of the globe. May I once again express our appreciation to all of you, to the students, to the participants, to the audience, to the reviewers, and everyone, our guests and our partners, for supporting this program and for your attendance this afternoon. It is hoped that this collaboration will expand widely in future. Till then, stay safe. Thank you very much, and Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you so much, Dr. Falha, for the closing speech. For the last session, We will have a certificate appreciation awarding that will be led by Dr. Saha. And after that, we will have a group photo session together. Okay, I will invite Dr. Salha again right now for certification appreciation awarding.
Okay,
Dr.
so we
Salha,
would
now
like,
the time is yours.
yeah, thank you, Miss Ika. So we would like to present our e-certificate, our digital certificate to all the participants for the Fatia Shaifuddin. Okay, now over to you. This is a e-certificate giving ceremony. Next, we have so this is Muhammad Farhan Wirakusuma. Thank you very much. This certificate is signed by the UniMAP Vice Chancellor, Professor Engineer Technologies Dr. R. Badrisha Ahmad, Singgalan Manimaran. Congratulations. You will be able to get the certificate soon, all right, from Madam Juliana. Hana Akilah Nur Imania, Hang Yu Hong, Siti Sarah Zakaria, Muhammad Aziz Kefli, Muhammad Haris Mahyudin Abdullah, and Adrian Jonathan Pakpahan, Fuad Haji Hussein. Thanks to everyone who has participated.
All right. Thank you so much, Pian Tunku, for the.
You're most welcome, Dr. Arthur. Thank you to you too.
Thank you. Thank you, Miss Ika, as well, for your hard work the whole day today. You have done a very good job. Thank you so much for being our moderator.
You
And
are
of
most
course,
welcome.
and of course, Mr. Sufino has been providing very constructive comments to our students. And really, as per what you have said, we really do hope to see everyone physically in near future. Hopefully, the COVID-19 pandemic will end very soon, or we shall open our border so that we can have our students cross border and finally meet each other physically. Now, towards the end of the event, I would like to call everyone in this group to switch on your webcam for a group photo session. All right?
So guys, please turn on your camera. Show the world your biggest smile and your very best expression. Okay.
Right.
It's done.
I'm going to show my screen so that you see what I'm looking at. Yeah. All right. So we have something like this. Everyone get ready. All right. Make sure you are smiling.
Dr. Arthur, why am my photo is too big? I should,
You have to like go back a little bit.
Yeah, I'm going back now to again.
All right, sure. All right, everyone, get ready. Look in front. I have someone. Yeah. Look in front. If you think your face is very big, just go back a little bit. Otherwise, your face will be as big as our body. Very good. All right, so get ready. We'll take our first photo in 5, 4, 3, 2, 1. Smile. All right, first photo done. We do 2 more. The second one will be freestyle, right?
Okay.
Yeah. All right, get ready. Freestyle. 5, 4, 3, 2, 1, go. All right, one last one. Okay, let's see. May I know who is sitting in the middle? The one sitting above Dr. Nico. Can you raise your hand? Yeah. So everyone try to point at her from your position. Yes. Try to point at her. All right. Get ready. Get ready. Everyone point at her. Look at your position. All right. Get ready. 5, 4, 3, 2, 1. All right. All right. That's all. That's all. Thank you
Good
so
job,
much for
guys.
your active
Good job.
Thank
participation.
you very much.
All right.
This
So
program
please.
is well done.
All
Good
right.
job.
Thank you, everyone. So those who have joined us today, remember to fill in your attendance form. We will open the form. The link is given in the meeting charts. So the form will be receiving submission until 2 p.m. in Malaysia time. All right. So please do try, and we will send out the certificates as soon as possible. The same goes to our invited reviewer as well. Our committee will send out the certificate of appreciation and the invitation letter to you very soon. We shall communicate through WhatsApp later. The same goes to Miss Iska as well. Miss Iska, thank you so much for helping us
You're most
today.
welcome. Thank you so much.
Thank you so much. So I think that's all for today. Thank you so much. I hope to see everyone in the future, physically or virtually. Thank you. Have a great time.
See you
Bye-bye.
guys.
See you
Another
guys.
occasion.
Thank you,
Bye.
everyone. Bye
All right.
Have a
bye.
nice
Thank
day.
you.
Bye-bye.
Thank you.
everybody.
Bye-bye.
Bye.
Thank you.
Thank you, Dr. Nico, Miss Ika. Thank you, Miss Ika.